Welcome to Podocyte Talk. In episode 29, we explore three important studies examining how interventions such as bariatric surgery, pregnancy, and SGLT2 inhibitor therapy influence long-term kidney outcomes and quality of life in people with or at risk for chronic kidney disease. These findings help clinicians better guide shared decision-making and long-term care planning in diverse clinical scenarios. We begin with a pooled analysis assessing how bariatric surgery affects directly measured kidney filtration rate and the accuracy of estimated kidney function. The study combined data from 7 clinical investigations and included 105 individuals undergoing metabolic surgery, the majority of whom had severe obesity. Directly measured kidney filtration rate declined by an average of 14% after surgery, particularly among individuals with higher preoperative filtration levels. Those with reduced baseline function experienced little or no change. The decline was only weakly associated with the degree of weight loss and more strongly linked to preoperative kidney function, age, and changes in systolic blood pressure. Common estimating equations underestimated these changes in individuals with preserved kidney function, but performed better when de-indexed and used in patients with lower function. Dual marker equations incorporating both creatinine and cystatin C had the highest accuracy. These results highlight the importance of interpreting kidney function cautiously in patients undergoing substantial weight loss and the utility of measured values, or dual marker equations, in this setting. Next, we discuss a systematic review and meta-analysis evaluating the long-term impact of pregnancy on kidney function in women with chronic kidney disease. This study synthesized findings from 36 human studies involving nearly 3,000 women and over 4,600 pregnancies, as well as 12 animal studies. In women with mild chronic kidney disease, kidney function remained stable after pregnancy, with no significant long-term deterioration observed over several years of follow-up. In contrast, women with more advanced stages of chronic kidney disease experienced a meaningful decline in kidney function post-pregnancy. Chronic hypertension further increased the risk of deterioration. Although the overall incidence of kidney failure or need for replacement therapy was relatively low, the findings support the need for individualized risk stratification. The authors emphasize that longitudinal data on kidney function slopes across pregnancy and the postpartum period remain limited, underscoring the need for further research to distinguish pregnancy-related effects from underlying disease progression. Finally, we turn to a prespecified analysis from a randomized controlled trial, evaluating the effects of Dapagliflozin, a sodium glucose cotransporter 2 inhibitor, on health-related quality of life in individuals with chronic kidney disease, with and without type 2 diabetes. Over 4,000 participants were randomized to receive either Dapagliflozin or placebo. Health-related quality of life was assessed using the Kidney Disease Quality of Life questionnaire over a median follow-up of more than 2 years. Participants receiving Dapagliflozin had significantly higher scores in physical and mental health domains, as well as in kidney disease-related symptoms, effects, and burden. Moreover, those treated with Dapagliflozin were less likely to experience a clinically meaningful decline in physical health over time. These findings suggest that in addition to slowing disease progression and reducing cardiovascular risk, Dapagliflozin may also offer important benefits in preserving patient-reported outcomes, further supporting its use across a broad range of chronic kidney disease populations. Together, these studies reinforce the need to assess kidney health through both objective and patient-centered lenses. Whether managing patients undergoing bariatric surgery, counseling women with chronic kidney disease about pregnancy, or initiating therapies like Dapagliflozin, thoughtful risk assessment and attention to quality of life are essential. Thank you for joining us on Podocyte Talk. You'll find references to all three studies in the episode description. Stay tuned for more insights from the evolving landscape of nephrology research and clinical care.